This episode of Food Psych is brought to you by my online course, Intuitive Eating Fundamentals. If you're ready to leave diet culture behind and reclaim the life it stole from you, learn more and sign up at christyharrison.com/course. That's christyharrison.com/course. Welcome to Food Psych, a podcast about intuitive eating, health at every size, and taking down diet culture. I'm your host, Christy Harrison, and I'm an anti-diet registered dietitian and certified intuitive eating counselor, offering online courses and programs to help people all over the world make peace with food. Join me here every week as I talk with interesting people from all walks of life about their relationships with food and their bodies.
I remember I was teething, little gums bleeding, cried every evening, it was all about eating. When I became a teen, it was all about beef, and now I'm ready for the world, trying to sink my teeth in, stacking extra cheese.
Hey there, welcome to episode 150 of Food Psych. I'm your host, Christy Harrison, and today I'm coming to you from a very loud hotel room in San Francisco. I'm tagging along with my husband, who's out here for a film shoot, and I'm planning to see my family too while I'm out here, but I had no idea how loud this hotel would be. So you might hear some honking horns in the background and some loud motorcycles and stuff like that. But I am in a closet doing a little radio producer trick to try to muffle some of the noise, so maybe you won't hear that stuff. I don't know. Anyway, just so you know, that's what's going on. But I'm really excited about today's episode, the honking notwithstanding, because I have a great show for you today. I'm talking with psychologist and trans health educator Sand Chang. Sand is really awesome. We discuss the complex experience of body acceptance for trans folks, the intersections of trans advocacy and the health at every size and eating disorder recovery fields, the shape-shifting nature of fatphobia and diet culture and how Sand got caught up in some of that stuff, and so much more. It's a really, really wonderful episode, and I can't wait to share it with you in just a moment. But first, I'm going to answer this week's listener question, which is from a listener named Katie, who writes, I've been a disordered eater for years, but made amazing progress with the support of a wonderful therapist. I've also had terrible chronic cystic acne since I was in middle school, and I'm now 32. The acne and the eating disorder kind of fueled each other in some ways. My mentality was, if I can't look good because my face is constantly broken out, at least I will be thin. I saw many dermatologists and tried all the acne meds to no avail. About 6 months ago, I discovered the world of natural acne treatments. Sounds great, right? Until I realized that a lot of it includes heavily restricting your diet. The theory is that certain foods all contribute to acne. Since my acne wasn't getting any better and I really felt like it was harming my quality of life, I decided to give this quote-unquote acne diet a try. And here's the problem. My skin is better for the first time in years. My acne is not completely gone by any stretch, but my skin is far more predictable than it was in the past. It has made a significant difference in my self-esteem, but it hasn't been good for my eating disorder. Now I don't know what to do. Restricting my food is not how I want to live my life, but constantly dealing with such terrible acne is also devastating. I would love to hear your thoughts on this. So thank you, Katie, for that great question. And before I answer, just my usual disclaimer that these answers are for informational and educational purposes only and aren't a substitute for individual medical or mental health advice. So yeah, this definitely sounds like a tricky situation. And I want to first just empathize and send a lot of compassion your way for what you're dealing with, because navigating both a chronic condition like cystic acne and an eating disorder together can be really tricky. It's a really fine line to walk. And the first thing I want to say is that natural remedies, as we've talked about on the podcast before, are often sold as this like panacea, right? This great thing that doesn't have any side effects. But in reality, they actually do have a whole host of side effects. And those can actually be really dangerous, like just as dangerous as the side effects of drugs, if not more so. And it sounds like for you, they are potentially more dangerous than drugs in terms of, the side effect that it's having on your mental health, on your eating disorder, because exacerbating your eating disorder is not something to take lightly. So that's like a really huge side effect of this treatment regimen that you're doing for your acne that I think it's really important to consider. And if you want to prioritize your recovery and you want to get to a place where your eating disorder doesn't have a hold on you anymore, I think you need to really look at what are some of the sources of restriction in my life around food and how can I minimize those. So it sounds like you're doing some natural acne treatments that might include other things than just changing the way you're eating. And so one of my first pieces of advice here is to see what happens if you drop the restrictive ways of eating and just do some of the other things that maybe have worked for you. If there's different face washes or different sorts of products to be using, or, if they talk about sleep or they talk about other self-care practices, it can be really tough to be scientific about yourself if you're doing a lot of different things. If you sort of dove headfirst into this acne treatment world and you're doing lots of different things that they suggest, it's hard to really know what's actually working, what's actually having the effect that you're seeing. And there's also the potential of placebo effects, which is a very real thing in any sort of natural remedy as well. So I would say, give yourself a chance to work out what might be coming from a placebo effect, what might be coming from, things that aren't the food restrictions, and see if you can let go of the food restrictions and, see what happens with the acne. The other thing is, doing these sorts of quote unquote natural remedies that involve taking out food is actually sort of a Band-Aid solution. This is something that Dr. Stephen Brotman has talked about. He's the founder of the term orthorexia, and he's a naturopathic doctor who has seen far too many people take naturopathic medicine to this really disordered degree that turns into what he terms orthorexia, an unhealthy obsession with healthy eating. And it can happen very fast when it comes to dietary regimens where you're cutting out lots of different foods. And his point that I think is a really wonderful one that is worth repeating again and again is that when you're restricting foods and taking foods out of your diet, you're not actually getting at what the underlying problem is that's causing you to have whatever the issue is that you have, right? The food actually isn't necessarily the underlying problem. The underlying problem is something else. It's some sort of reaction that your body is having. And in the case of acne, especially adult acne, from what I understand from, talking to endocrinologists and also having my own history with cystic acne, any form of adult acne is really likely to have a hormonal component to it, meaning that there's some sort of hormonal thing likely going on for you that is not just about your skin, but that's the real underlying condition there. And so I would wonder if you've ever looked into what could be going on for you hormonally that might be causing the acne. I mean, it sounds like you have a long history with it, but hormonal conditions are real. That is a huge cause of adult acne, and the science and stuff on hormonal health is a whole rabbit hole unto itself. So I would encourage you not to start to consult Dr. Google about it, because that can lead down a really disordered path too. But find an endocrinologist who really understands eating disorders. And I think that could be incredibly helpful for getting the underlying hormonal imbalance figured out if that's what's going on for you. And it sounds pretty likely, because at 32, that's not like teenage acne anymore. That's adult acne, right? And when you're engaging in disordered eating, it can actually cause hormonal imbalances that lead to having high testosterone levels relative to your estrogen levels. Whatever your gender, we all have both of those hormones. And if your testosterone levels are high relative to your estrogen levels, and you're in a cis female body in particular, that can cause acne, especially around your period, but also in general. And of course, I'm not an endocrinologist myself, but from what I understand from my research and talks with endocrinologists, disordered eating really has a huge impact on acne, and it's worth looking into whether restrictive eating patterns and suppressing your natural weight and your natural body fat could be contributing to this hormonal condition that's causing your cystic acne to recur. I would also recommend getting evaluated for polycystic ovarian syndrome, also known as PCOS, and get tested for something called late onset congenital adrenal hyperplasia. I know that's a mouthful. Late onset congenital adrenal hyperplasia often mimics many of the symptoms of PCOS, but it has a slightly different cause. So I think it's really important to get checked out for that too. It's more likely in certain subsets of the population, like people who are of Ashkenazi Jewish descent. I think people who are of Italian descent, a number of other ethnic groups are at higher risk for it. So find an endocrinologist who gets it and ask to be tested for that as well. PCOS is something that has a lot of diety advice that gets thrown at people. So if you end up having PCOS, check out my amazing colleague, Julie Duffy Dillon's anti-diet resources for PCOS. And again, I would not go down a Google rabbit hole looking for PCOS resources or let your doctor try to put you on a diet, because there's some really diety stuff out there for PCOS and it's not actually helpful. So the only thing I'd really recommend Googling is Julie Dillon PCOS. We'll put a link to her in the show notes. Dillon is spelled Dillon. She's got great resources for that. So you could definitely check that out if you end up being diagnosed with PCOS. And if you turn out to have late onset congenital adrenal hyperplasia, which is more rare, but possible in cases of adult acne, there are specific medications you can take for that control the acne. And thankfully, that's a diagnosis that doesn't seem to carry a lot of diet culture baggage with it yet at the moment. Let's hope the diet culture doesn't get its claws into that diagnosis too. So that is, what I would recommend in terms of getting, a follow-up, getting the right sort of medical care to look into this stuff. And it's possible that you've already looked into this in the past. So I apologize if I'm repeating something you've already done, but it sounds like from what you've said, you've mostly focused on going to dermatologists. And they're not really looking at the deeper causes, the hormonal causes of acne. They're just looking at the skin, your skin health and what you can do, medications you can take to improve that without necessarily looking at what's going on for you hormonally. And as I said, it's really important to find an endocrinologist who understands eating disorders so that they don't inadvertently trigger you and say a bunch of diety stuff that leaves you, worse off, which can sometimes happen. On a deeper level, though, I would say it sounds like your appearance is really important to you and plays a really big role in your self-esteem. So that's really something to work on and continue working on with your therapist. And hopefully you're in therapy for your eating disorder already, and you have someone who's really knowledgeable about that stuff, knowledgeable about body image and eating disorder recovery and health at every size and all the goodness we're always talking about here. So if you don't have a therapist already, I would recommend finding one who really gets it. You can look at the Certified Intuitive Eating Counselors directory for some recommendations. You can also look at the Health at Every Size providers directory, which you can find at hayescommunity.com. We'll put links to that also in the show notes. But I think it's really important to work with a therapist on these issues because, I know that cystic acne, I've struggled with it myself, so I know how painful and unpleasant it can be, how uncomfortable, physically that it is. But there's also this deeper piece, this psychological distress. And that's something that you can work to make some headway on so that your appearance doesn't govern your self-esteem like it sounds like it already does. Because it sounds like your eating disorder sort of came out of this idea that okay, if I can't control my appearance in one way, then I'll control my appearance in another way. And either way, appearance is, the deciding factor or one of the biggest deciding factors in my self-esteem. It sounds like that was sort of the place that you're coming from. And so, I just want to invite you to open up to the idea of what would it look like to have your self-esteem not be contingent on your looks, on your appearance? What would it be like to let that go a little bit? And so that even if you're still struggling with acne for a while, letting go of how much that defines you, how much that defines your self-esteem and self-worth. So that is definitely a tall order, I know, but I think it's really important and really worth it if you're trying to recover from an eating disorder, not to put yourself in a position of doing a treatment that has the potential side effects of really exacerbating your eating disorder, and it sounds like it is. So it sounds like this natural acne treatment, quote unquote, that you've been doing has some really negative side effects, really dangerous side effects for your eating disorder and for your mental health. And so I would say, let's look at some other ways that you can help your acne, that you can work with, feeling better about your appearance, even if your acne doesn't improve or only marginally improves, and maybe holding on to some of the natural acne remedies that don't have anything to do with cutting out food, but that are just more about self-care or skin regimens. So I hope that helps, and, definitely let us know if you have any follow-up questions. And for the rest of you listening, if you want to submit your own question for a chance to have it answered on an upcoming episode, go to christyharrison.com/questions and enter your question there. That's christyharrison.com/questions. Then if you want a whole library of answers from me to help you master intuitive eating, plus the chance to ask me any question you want, you can join my online course, Intuitive Eating Fundamentals. The course has hundreds of answers to specific questions about intuitive eating and an exclusive monthly Q&A podcast where I answer your question every month. So you can ask me your questions and get lots of individual attention in this course. You also get access to our private Facebook group exclusively for course participants. And I'm in there every weekday connecting with folks and answering questions, along with my wonderful team. And there's also hundreds of fellow participants in the Facebook group who can support you as well and connect with each other on this intuitive eating journey, because we all need support when we're doing this anti-diet thing, because it's swimming upstream. It's not a mainstream thing, and there's not a lot of people probably in your life who are on board with this, who get it. So having a support system of people who do get it and can help you through the difficulties, the ups and downs of the intuitive eating journey is so important and so essential. So if you're ready to become an intuitive eater and leave diet culture behind so that you can reclaim your life, learn more and sign up for the course at christyharrison.com/course. That's christyharrison.com/course. I also want to let you know that we've got some great food psych swag still available. We made t-shirts and mugs with one of my favorite quotes from the podcast, which is self-care, not self-control, because that's my mantra for really cultivating a peaceful relationship with food. Now you can wear that mantra across your chest or see it every day while you sip your coffee or tea as a reminder that your mental health and well-being is just as important as your physical health, and that true self-care is about taking care of your mind and your soul by giving yourself pleasure, satisfaction, and freedom with food. Grab your shirt and mug today at christyharrison.com/swag, SWAG, which stands for sealed with a gift, apparently. That's christyharrison.com/swag. And now, without any further ado, let's go talk to Sand Chang. So tell me about your relationship with food growing up.
Well, I love that you asked this question. I think, what draws me so much to your podcast is just this recognition that if we're working in the field, that we have to look at our own sort of history and possible biases. And, I'm a big fan of just, having to do our own healing work in order to be able to help the people that we serve. As a mental health provider, I don't really trust people who haven't done their own therapy, their own reflection or growth work. And I thought a lot about, how I wanted to answer this question. And it's tricky because, as I'm changing, my narrative is changing as well. But I will say that, there are many factors, I think, as there are for most people. But, in my family growing up, so I'm Chinese American, and I think culturally and especially, I don't know if my family was more so or less so this way, but food was definitely love. Food was a source of connection. And it was really, the only time that we were together. So my parents were working a lot and I was home a lot alone, either by myself or with my older sisters. And so it was, this moment where we could all be together. And so, I think for a long time, I was very angry about food being used as a substitute for love or connection or attention. And in retrospect, I really see, this was the way that my parents learned to show up and provide. And so I don't want to just pathologize that, but definitely was all about the food. And my mom just loved feeding us. And so I was very much encouraged to eat. And I'm grateful that in my immediate family, there was never any kind of, fat shaming or, messages about not eating a certain way. I mean, it was fairly open and permissive in terms of eat whatever you want. And so, yeah, definitely I was encouraged to eat.
That's pretty unusual, I feel like, in a lot of families, not to have any of those messages.
Yeah. I mean, on the flip side of that, there was the way in which my mom very much, if I didn't eat, she might feel hurt, so it gets complicated and sort of mediating love and care and expressions of family were through food. But yeah, I definitely didn't get any sort of messages like that inside my home, but I was definitely getting them outside the home. And I mean, I should say that also inside the home, I kind of, as a youngest child, I took on this identity, and I don't know if it was me or what other people were projecting onto me, but I had the identity of like the little fat kid. And I remember I even had like pajamas that said, my diet starts tomorrow. And like there were like Garfield, like I really identified with Garfield. And like one pajama set even said, diet is die with a T, which is kind of hilarious now, considering, how I think about dieting today.
It's pretty amazing. It really set the stage.
Yeah. So, I mean, outside of the home, I definitely feel like diet culture was so pervasive, but so unconscious. And for me, it was never about, at least until later, it wasn't about losing weight or looking a certain way. So I have an older sister, she's 8 years older than me. And she started dieting when she was 13 and I was 5. And she got one of these books and was counting all her calories. And I just joined in, like she's doing this, I'm going to do this. And I remember doing like Jane Fonda and Richard Simmons videos with my sisters. And I don't think it was ever conscious, like I need to lose weight. It was just, this is what we're doing. And I think that's just an example of how pervasive diet culture can be, and without even being conscious that we're participating in it.
Mm-hmm. Yeah, I think those like cultural memes from the 80s, like, Jane Fonda and Richard Simmons, and just a lot of like fitness culture, especially, was so steeped in diet culture. And it wasn't necessarily overt. It wasn't necessarily like, oh, do this to lose weight, or this is for people who want to lose weight. But it was sort of like, a fun thing people did to bond or to get active or whatever. But it was like infused with diet culture sort of throughout.
Absolutely. And so much fat phobia. In fact, I remember this one video that before it got into the whole like exercise part of it, it showed fat people eating. Oh. And it just really framed this sort of view of disgust with eating and like junk food and, oh, let's set you up so that this is the solution. So, I mean, looking back, I'm thinking, God, that is so young to have that kind of exposure.
Totally.
And at the same time, I was being told I had a pediatrician who, every time I went in, I was told I needed to lose weight. His name was actually Dr. Small, and I just hated his guts. and I felt angry. I remember feeling really angry as a kid. So even at that age, I was like, I'm not going to fully buy into it, even though I eventually really did. And then another factor was that I started dancing when I was really young. So I was always in dance studios and definitely like the fat kid in the studio, kind of like really good dancer for a fat kid sort of thing.
Was that message like said to you ever, or was it just sort of implied?
It wasn't when I was younger. I felt like it was sort of a cute thing for a while until it wasn't cute. Mm-hmm. Like the way that kids can be cute when they're fat. Like I have this like really strong identification with like Chunk from the Goonies, and until it wasn't. I mean, definitely when I got into high school and I was dancing, I had messages like, you're not going to make the team if you don't lose weight sort of thing. And I was never excluded. I would make the team, but it was still this message of like, your body is not like the other people's bodies on this team. So yeah, definitely the diet culture messaging was all over the place. Now I can see it with a different lens.
Mm-hmm. Yeah, you probably didn't know it as such back then. It was just like the way things were, the way, you weren't matching up with how you're supposed to look or whatever. So yeah. And how did that affect your relationship with food?
In the development of my eating disorder, I think it was a combination of factors. Part of it was some form of anger and rejection of the familial ways of expressing love and communicating, and the dysfunction in my family that I felt really angry about. Some of it was about just what I was seeing around me that was very normal, being around dancers, being around other, tumblers, gymnasts. And then I really can trace a lot of my eating disorder to specific events that happened that were related to trauma when I was a teen. So, I was definitely acting out a lot as a teen, really angry. And I think, looking back, there was a lot of an unconscious desire to just not have a body and not have needs. So for me, restriction and overexercise were the main ways that I enacted my eating disorder. And, as a teen, I joined a gym. And as soon as I joined a gym, it was like full on, because I'm kind of a person of extremes. And I was, really struggling with some other addictive stuff. And I just thought, well, exercise is the answer. So, I was exercising. I was avoiding social contact by exercising. It was sort of a form of emotional anorexia and keeping people away. And I had my first major weight loss, and it really was a pretty unhealthy amount of weight in a pretty short period of time. And it was that really, I think, set off the eating disorder, because until then it was just, I really, this feels good to me to exercise and this much. But then all of a sudden it was the like immediate and overwhelming positive feedback that I got from others. And then I kind of got it. Then it became about intentional weight loss, like in a different way.
I feel like that's so common, like in people whose eating disorders start for other reasons. And it's just another way in which diet culture perpetuates eating disorders. Because I've definitely known people that I've worked with and people I've talked to on the podcast as well, who like kind of stumbled into an eating disorder because it was a way to regulate emotions, because it felt good, because it was, sort of numbing or comforting. But then, the weight loss that resulted from it, or from the restriction really, was praised. And then it was like, oh, and then it's on, right? It's like, then the weight loss is off to the races.
Absolutely. And just, I talk a lot with people about body appraisal and surveillance. And I think that, I definitely got a lot of teasing for being fat when I was growing up, but I got much, much more sort of socially acceptable praise. But all of it's body appraisal and comments that kind of give a message that your worth is based on your appearance, in particular, your weight. So it was pretty intense. It was very reinforcing of the behaviors. And until then, I had really not spent much time getting on scales or anything. And all of a sudden it was like, okay, I got to track this. I got to manage it and keep this going.
Yeah, it's like as soon as you get those compliments, the desire to keep it going really sort of comes up. I've seen this even in people who I work with that are unintentionally losing weight from actually caring for themselves, which doesn't happen for everyone. It's like a small percentage of the population that when they start intuitive eating might, lose some weight unintentionally because that's just what their body wants to do. And that's almost just as dangerous as intentional weight loss and getting praise, because in this diet culture, no matter what reason you have for losing weight, even if it's like a grief or a death in the family or something that's, causes tremendous emotional trauma and you can't eat or whatever, and that's why you're losing weight, like even unintentional weight loss like that gets praised and then triggers off that same desire in people to sort of control it and make it keep happening,
Yeah, absolutely. And I think at kind of a vulnerable age, really looking towards, others for external validation and a vulnerable state after having experienced some trauma, that it was just like, it clicked for me.
Yeah, you needed that kind of coping mechanism, it sounds like.
Yeah.
And so, how did it go from there? What ended up happening?
So, I'm actually really grateful for what happened next, because I think that my eating disorder could have continued for much longer had I not injured myself. So my first semester in college, I think within the first couple weeks, I started dancing with a group on campus. And I tore my lateral meniscus in one of my knees. I had actually had surgery prior to that on my other knee. So there was a lot of overuse. So I injured myself and I couldn't dance. I couldn't exercise. And I was really depressed. I was miserable. It's like, I just got to college. And that was a pretty big turning point for me, because that's what got me into therapy, like getting that depressed because I couldn't exercise. I didn't have that coping mechanism. And so, I was really unhappy. I got into therapy. And the therapist that I worked with, it was pretty clear immediately that there was stuff going on with my food and body. And when I think about my eating disorder history and recovery, I think a lot about just like relative recovery and sometimes the ways that I got better or sought help or received resources or support that was both helpful and harmful at the same time. So I think at that time, I started to really adopt a narrative of being an eating disorders recovery, but having a lot of unconscious, sort of the more subtle, deep diet culture and eating disorders thinking very much present. So, for example, I got referred to a nutritionist who was, she worked as a nutritionist for a very mainstream national health organization, and I saw her for years. But she had me tracking my food, and she was weighing me and working on portion control, and I thought this was, the help that I was getting, and I got a lot of help from her. But it also reinforced this like tracking behavior. And I'm kind of an obsessive tracker anyway, like with other things. And so, and she never once mentioned the possibility of health at every size or intuitive eating. It was kind of like, I think she was having me track my hunger, but there was still this idea that I had to, count certain hours. And that was the time that I was supposed to eat rather than actually listen to what my body was telling me it needed.
It was like the hunger and fullness diet kind of thing.
Yeah. And there were sort of like rules that I think were not helpful. Like she introduced me to this idea of like the rule of two, which was like don't have more than 2 desserts on the same day or at the same time or 2 days in a row.
Oh, no.
So it like kind of like reinforced this sort of rule following around food. And this idea that I should stay away from dangerous foods that might trigger me, even though my main problem was restriction and overexercise.
That's really, it's so frustrating when that happens. Like,
yeah.
Did she know, were you ostensibly going to see her for the eating disorder recovery, or was it sort of like after you? Yeah. So she knew that it was supposed to be for recovery.
You know, I think it's one of these things where when people have a quote unquote normal body weight, then they don't get the attention they need for an eating disorder. Well, I had an above quote, whatever, you know, my BMI is a little higher or whatever. And I think for that reason, I don't think that I was really seen as someone who could be restricting. It was like, okay, well then, you know, compulsive overeating must be your problem. Whereas, you know, for me, what I thought was a binge was like 2 servings of something, you know, and it was really, you know, distorted. And, you know, I may have been hiding things too. Who knows? You know, like I may have not been giving the full picture, but, you know, that was one piece of it. Another piece of that early recovery for me was starting to work with a personal trainer who, you know, what was helpful in that he put limits on how much I could actually exercise. And I had never had any limits. And so that was incredibly painful, but it was necessary.
Yeah, that sounds really helpful, actually. Like how amazing to stumble into a trainer who's willing to do that, because I feel like some trainers might just co-sign it, you know?
Yeah. I mean, there were other ways that he also was encouraging weight loss. You know, so it wasn't perfect, but at least I got that basic idea that someone is seeing this and someone is seeing that it's too much. And that was really helpful for me because sometimes I don't see my own limits in many ways, whether it's about work or whatever else. And so, you know, I think that was really helpful for him to see that and for me to start paying attention. And for years, really, you know, still struggling with overexercise, but at least I knew that it wasn't okay to work out twice a day. Or like there were at least some really basic ideas that I had that was like, okay, but it was still rules.
It sounds like it gave you permission at least to sort of let go of some of the intense overexercise.
Right. And then, I mean, another piece of this was I was introduced to Fatso by Marilyn One. Like I was on campus and she actually came to speak to this student group that I was involved in. And it completely blew my mind. Like I got her book and I mean, it was really radical at the time. This was the late 90s. And it really planted a seed. But, you know, when I look back, I see how much I was like, yes, this makes so much sense, but not for me. You know, so I had this like, yes, you know, starting to really embrace this idea of, you know, size acceptance, but not for me, but for other people. Starting to get really angry at fat phobia, but still not being able to apply it to myself. Having all these rationalizations and excuses like, oh, well, I'm a dancer, or my parents have type 2 diabetes, or, you know, just whatever reasons that I couldn't apply it to myself.
I feel like that's so common. And I definitely hear from people who listen to the podcast or people who are like coming to me as clients from listening to the podcast, you know, saying that like they are really embracing the idea of size acceptance and health at every size and, you know, looking at it as a social justice issue. But then for themselves, it's so much harder to actually apply those principles.
Absolutely. And, you know, being in so many of my social justice communities, queer communities, where I really do feel like I've gotten to just be exposed to so many badass like activists and people doing work in this field. Like I have a lot of friends and community members and fellow performers who are involved with like No Lose and a performance group called Big Moves in the Bay Area, and just really being able to celebrate it for other people and still just, you know, for years, just still feeling like it couldn't quite apply to me.
Yeah, I totally identify with that. How did that play out for you? Like, how did you move from, and also I want to talk a little bit about those identities that you mentioned, like your queer identity and also gender identity, sort of what role that played in your eating disorder history and your recovery as well.
Yeah, I guess I didn't really talk about that. Sort of how we talk about trans people and trans health and history is really fraught with a very prescribed narrative of what it means to be trans. And that really applies still to how we talk about bodies and how we develop. And so, I'm always suspicious about how I talk about my own narrative because it's confusing still to me. I'm still working out so much of this. But, definitely as a kid, I didn't feel like I was like other girls, so in that way, I do sort of fit this sort of stereotypical narrative. I definitely felt different, but I don't know that it was just about gender. I mean, part of it's about race, being Asian American and, growing up with all these like skinny white girls, all over the place. And
it's almost, I was going to say like othering almost, like fatness is sort of othering in a way.
Yeah. Definitely growing up fat, I felt othered anyway. And so, the experience of being different, I can say it was because of this or because of my size or because my parents are immigrants and I'm a Chinese American or because my gender didn't feel right. But I definitely felt like I just didn't really feel like I related to other girls completely. And I didn't relate to boys either. Like I have a very genderqueer, non-binary experience kind of woven throughout my childhood. Looking back, I see it, but it wasn't very conscious for me until I was in my early 20s and sort of coming into a queer community and queer identity and realizing that, there were certain labels and certain ways of thinking about gender that just didn't fit for me. So I don't identify as a man or a woman. And I do identify as non-binary, genderqueer, fluid, and femme, which confuses people. Sure. And so, for me, I noticed there were ways that I presented myself gender-wise in terms of my gender expression that sort of gained acceptance and praise. And in some ways, like parallel to the ways that I would gain acceptance or praise for having a smaller body size. And so as a, trans-masculine, genderqueer femme in trans community, I definitely felt these pressures to pick a side, including from people I dated, often other trans-masculine folks who, for whatever reason, were invested in me being more masculine or feminine. And so there's a lot that's tied up with gender expression, sexuality, and how I was mediating managing my appearance. And weight ties into that because if I am at a smaller size, I may be seen as more masculine or more androgynous. Whereas when I put on weight, maybe more curves, then I'm seen as a little bit more feminine. For me, it's not just about how other people are seeing me, it's how I feel in my body as well. So, that's hard stuff still for me to tease apart, and it's an evolution and it has been for years. I feel like I have been so appreciative of writers and activists recently who have really started to call out some of this very binary and fatphobic kind of stuff that's going on in trans and queer communities. This idea that to be androgynous, you must really not have a body, or like it has to be totally neutral,
Mm-hmm.
And of course, a lot of this, I'm very suspicious about anyway, because the ideals that we have for what trans bodies are supposed to look like are based on white, skinny, sort of, model looking people. And it really excludes folks who, are fat, disabled, people of color. And, there are so many ways in which these dominant norms that we have and dominant representations of trans identity don't leave room for the vast majority of us.
Yeah, that's so important to call out. And, thank you for sharing all that. Because I think the idea that a body to be seen as non-binary needs to be quote unquote androgynous, I can imagine, and I've seen in clients too, like how much that plays into eating disorder behaviors and thoughts. And, diet culture just really gets a hold of that and says, well, great, this is very much in line with diet culture's agenda. And so I'm really curious about, the work that you do with trans health and also with your own recovery story, sort of how you have learned to navigate that and how you help other people navigate that, like the ideas of body norms within the trans community or the queer community, and how to push back on those in a way that, helps protect your own recovery, but also how to navigate what you feel your true gender expression is and how to not let that get tied up in the eating disorder thoughts or the diet mentality thoughts.
Yeah. Oh my gosh, there's so much.
I know. Even as I was asking the question, I was like, this is convoluted.
Yeah, there's so many pieces to this that I want to talk about. And I kind of am always trying to talk to people about this stuff. And there are people having this conversation, but not enough. So, there's a growing body of research about trans folks and eating disorders. And, the research that we do have suggests that trans folks are at greater risk for developing eating disorders than cisgender people. And cisgender meaning people who are not transgender.
And then even cisgender women who have historically been considered sort of the greatest risk of eating disorders, transgender folks of any gender kind of exceed that risk, right?
Right, exactly. I mean, we know that representations of who has an eating disorder are completely skewed, and they don't, include people of color either. But given some of the information that we have, it's like, okay, we're not actually paying attention enough, and we're doing a real disservice to trans folks who really need medical professionals and mental health professionals to pay attention. And again, regardless of body size, and so I think there's a lot of just body appraisal around gender and weight, which is, I am looking at you and I think that based on how you look to me, you probably don't have an eating disorder, or you don't need to lose weight, or looking at people and these messages around having to lose weight that come from medical professionals. I will say that the research is still kind of fairly new. We don't know a ton, but a recent article I just read also talked about, needing to get away just from looking at trans men versus trans women, in a pretty binary way, and looking at, who experiences eating disorders more and how, but also looking at binary versus non-binary presentations and how other people look at you, and it not being just about having to fit a certain stereotype for what men's and women's bodies look like, but also the minority stress that comes from being constantly misgendered and how much that ties into, coping and attempts to manage aspects of the body that maybe there's an illusion of control there when people can't manage their gender expression necessarily without seeking medical interventions, which are actually inaccessible to so many people. I mean, we have more access than we used to, but there's still a lot of gatekeeping, and there's still a lot of barriers for people who really need interventions to be able to, be well and live their lives.
What are some of those barriers? What stands in the way of that?
Well, I think the gender binary is definitely one of them. We have this narrative that if you don't want to move from one box to another, then you must not need medical interventions. And that's not the case. There are people who, identify as non-binary who do want gender-affirming medical care, whether it's hormones or surgery. But if they don't sort of spout out a narrative that maybe society deems as acceptable or familiar to them, then they may not be able to access that care.
So like a therapist would be seeing a client sort of in preparation for one of these interventions. And if they can't check the box that's like, oh, I always felt like X gender and I'm in the wrong body and, I want to move from this gender to that gender. It's like, it doesn't.
Exactly.
Yeah.
I mean, ridiculous things. Like example is, a patient I worked with was denied a letter for recommending surgery from another mental health professional because they were wearing quote unquote female rings.
Oh, oh my God.
Because only, like women wear rings on their hands. And, so just these like very like ridiculous, outdated ideas about what it means. And that actually create these standards for trans people that cisgender people would never be asked to meet. Like cisgender women don't have to wear dresses or wear makeup every day. But there's a real expectation that trans women have to be super femme. Or that if you're a trans man, you have to be like really, masculine and butch or whatever. Whereas, there are like feminine men and masculine women, and there's like so many spectrums and ways to identify and express one's gender. So I absolutely see that these like very old school ideas about what it means to be trans and who deserves to access care or not are in place. And that includes, having any mental health concerns. And that's tricky because, there are standards of care in place that do recommend that before people access certain gender-affirming medical interventions, that they have a degree of stability or quote unquote reasonably well-controlled mental health symptoms, while at the same time needing to have a diagnosis of gender dysphoria. So what it means is that trans folks often have to walk this line with mental health providers or providers in general, where it's like, I'm sick, but I'm not too sick. And in order to get the care that is really needed.
So if they're really like breaking down under the burden of feeling like they're in the wrong body or they're, having the gender dysphoria or just other issues like humans have, and also probably the added issues of like navigating the world as a trans person and having to deal with discrimination and misgendering and all that stuff.
Yeah.
Then it's like, well, okay, now you're too sick and you can't get care like at that point, which is ridiculous.
Exactly. And it's really hard to tease apart gender dysphoria from other mental health concerns. I mean, it's really, I can't draw a line between, this is the gender dysphoria and this is the depression. And you have to cure the depression, but and recover from it, but you have to still have the gender dysphoria. It's impossible. And I feel similarly around the eating disorder stuff, that it really is hard sometimes to tease apart what is gender related, what is just weight related, because you can't actually separate those into neat little categories and boxes.
Yeah. It's occurring to me right now that just in case anyone listening doesn't know the word gender dysphoria, the term, and how that differs from body dysmorphia, because I hear people conflating them sometimes. So if you could give a definition, that would be great.
Okay. Let me see if I can.
Just, put you on the spot there. But.
Okay. So gender dysphoria is both a symptom and a full syndrome or diagnosis. So it is in the DSM-5. It's in previous versions of the DSM, it was gender identity disorder, and now it's changed to gender dysphoria, which some people argue is, more affirming, while other people argue that it really doesn't leave a possibility of a disorder-free trans experience. And there are trans people who have gender dysphoria, and there are trans people who don't. But if someone does want gender-affirming medical care, they do need to endorse that and kind of meet criteria. And what we know about mental health diagnoses is that, the full criteria, a lot of people don't meet that, including for eating disorders. So many people who don't meet anorexia or binge eating or bulimia diagnoses.
And those criteria can be so narrow, right? I know when we were emailing, you talked about how like those criteria really leave out a lot of marginalized groups and people of non-white ethnicities and stuff like that.
So much of this research and so much of the norms are not based on like the full spectrum of people out there. But I don't know that I totally answered what is gender dysphoria. And so I think maybe a simple definition is there is significant distress related to one's body or appearance or kind of gender role in the world, and it's gender related, right? So it might be discomfort with secondary sex characteristics. A lot of people develop gender dysphoria during puberty, when those sex characteristics are coming into play. Some people have gender dysphoria from a very young age, as soon as they start noticing that gender is a thing, like age 3 or 4. Other people don't sort of start having gender dysphoria or noticing that they have it until maybe they're starting to be sexually active or kind of in adolescence, early adulthood. And then other people don't actually have an experience of gender dysphoria. But it's pretty controversial. And in trans health, it's a challenging conversation. And there are experts who are on both sides. There are people who argue that if we don't have the diagnosis, that we can't actually advocate for the medical care that people need, because you need to have a diagnosis for any kind of medical intervention or service.
Wow. So that means that people who are trans and might identify as like non-binary or something, but haven't had a particular experience of gender dysphoria might not be able to access that care.
Yeah, because they don't fit a more sort of, literally like textbook, like the DSM-5 definition, whereas some non-binary people do, though. And so I am really a big fan of just talking to people and seeing what's going on and like, how do you feel and what do you need? Instead of saying, let's come up with the like perfect terminology and the perfect box to fit you into based on other people's experiences. I think, really to do patient-centered care is to meet people where they are and not try to force them into something that we learned in our training. And most of us, by the way, in medical and mental health fields, really never got adequate training in working with trans folks. I certainly didn't. It was my own personal experience and kind of this discrepancy between what I was seeing, how we were having conversations about gender in my graduate psychology training, and then what I was experiencing in my personal life around, with my own identity and people in my life transitioning or sort of coming into their own queer and trans identities.
Yeah, it doesn't really seem like it gets taught at the training level. I certainly, as a dietitian, didn't get trained at all in that until, continuing education, until I was finally a dietitian and then was going to conferences and stuff. And I first learned about trans health and the intersection of transgender and eating disorders at an eating disorder conference. And, thankfully, there's some really awesome progressive eating disorder conferences out there that are talking about this stuff. So I went to like 2 different conferences that had workshops on, transgender identity and eating disorders. And that kind of sparked my interest in it, because I was like, wow, there's this whole other sort of area of people's identification that I hadn't even looked at or thought about. And it's just as important and deserves just as much social justice attention as any of the other identities that I'm always, fighting for and interested in kind of advocating for. So it's like, yeah, it takes a lot.
And so much of the work I do is training. Like, I'm an educator. I love teaching. And so I'm often trying to sort of raise awareness about eating disorders and sort of like diet culture and fat phobia within trans health. And sometimes I'll go to gender conferences and there'll be like one session, but not a lot of conversation. And then in the eating disorders world, or treatment, like professional world, definitely not enough conversations. And I've certainly had a lot of clients who've struggled when trying to get eating disorders treatment, including in inpatient settings, and just feeling like they're not getting their needs met, and, really finding some of the treatment approaches harmful. Sometimes it's like this acceptance messaging, which is, well, just accept your body as it is. And that actually is not a bad, it's not inherently bad as a message, like being able to come into like loving one's body and appreciating it, while at the same time, when it is applied to gender and trans bodies, it can kind of go in the direction of like, oh, well, you shouldn't want to change your body. You should just accept it as it is, or you should just be a woman, or, just like conform to what your sex assigned at birth lays out for you in terms of gender identity.
Yeah. Like, I'm curious, your thoughts around that in terms of like, how do we facilitate and, advocate for people's body acceptance in terms of like size acceptance or acceptance of, their natural, like, well, I don't even want to say natural, but like their, the characteristics that diet culture would just, want people to shave off basically. And, to try to make people conform to this narrow beauty ideal, but also like making space for the fact that gender dysphoria does exist and people do have, a hard time with certain aspects of their bodies because of how it relates to gender identity, and that doesn't, that we don't sort of elide that or exclude that from conversations about body acceptance.
I mean, I don't have an easy answer, honestly, to this, but I think that when we talk about acceptance, it is helpful or body acceptance, it is helpful to try to understand the nuances and to be able to hold somewhat or seemingly contradictory ideas, this sort of dialectic of acceptance and change, and that maybe there are some ways in which we can support an acceptance of certain aspects of one's body while also recognizing that sometimes the only intervention that is going to help someone to reduce dysphoria, reduce mental health distress, sometimes reduce suicidality, and also increase safety in the world, sometimes it does require a medical intervention and that kind of change. And part of the acceptance messaging could be accepting yourself as being trans and needing to get this care, and needing to, go through whatever that means, whether it's medical or not. Some people don't actually need that, but some people do need to transition socially. So really just I really want professionals who work with trans folks to kind of have a little bit more of that nuanced view and to help people to be a little bit more discerning. And again, we can't always identify like this is the weight stuff versus this is the gender stuff.
Yeah. And I'm curious, your thoughts around like the weight stuff in terms of helping people heal from diet culture and heal their relationship with food and their bodies, in the midst of maybe some gender dysphoria or transitioning or whatever, and how we, just sort of like do the best that we can as providers or advocates and activists for anti-diet stuff to like make space for people's experiences, but also to like, hold a firm line against diet culture. Because I know that you've said that like there are sometimes BMI requirements in being able to get gender-affirming surgery, right? And so like that's a piece where it's like clearly problematic,
Yeah. Oh, it's so complicated. I was just meeting with a colleague and we were over breakfast and we were just talking about this stuff, and I'm really passionate about it. And I mean, I think the first thing is that we need to make space for trans fat people, and trans fat bodies and bodies of all sizes. I think what happens is sometimes trans folks can see medical providers and this idea is that, oh, well, if I'm going to help you to have your gender be expressed more in line with like a man's body, quote unquote, man's body or quote unquote, woman's body, then it has to look a certain way. And that way does not include, being overweight or fat, right? And so there's that bias that is just ever present in a lot of medical interactions. And then when it comes to the BMI conversation, like I will just put out there, I'm not a medical provider. And so I try to be humble and try to listen because at times there is a medical justification or rationale around safety and being able to go into surgery. So what does happen though, and I've seen this in my clients and patients, I've seen this in friends and loved ones, is wanting to go and get some kind of gender affirming medical intervention, like a surgery, and being told that, yes, you're a good candidate for this surgery, but you need to lose weight first. Even a few years ago, the BMI requirements I was seeing were higher than they are now. Like I've seen them go down over time. So typically people over a certain BMI are told that they need to lose weight. And, sometimes with some referrals to resources to do this and sometimes not. And to be told to, just lose weight is really problematic and, really not informed by what we know about intentional weight loss.
Like as though intentional weight loss can just happen and that people could just do it and then they'll have sustainable weight loss forever.
Yeah. And then you get to a certain place and then you stay there. So the weight cycling that I think is encouraged, and, for people who they really need the surgery or whatever it is, that it really does encourage quick, rapid weight loss, eating disordered behaviors and mentality. And, there are people who push back against this, but there are also people who are like, okay, this is what I have to do. I'll do whatever because it's about survival.
Do you know doctors and medical facilities that are more open to accepting people in larger bodies for gender-affirming surgeries? Like, is that a thing that, in the sort of haze trans health world exists?
Honestly, no. I mean, honestly, I really don't think haze is part of the conversation that I've seen in most trans health circles or medical systems. I think there is just this sort of very overly simplified kind of oh, these are the facts. Of course it's better to lose weight. And sometimes I'll hear things like, well, but it's better anyway if the person loses weight. So, this is a good motivation. So it's kind of like dangling a carrot. I mean, literally, not literally, yeah. And so that being said, there are sort of reasons why at times people do need to be at potentially lower weight to be safe to go into surgery. I feel really conflicted about even naming this, but I don't want to come into this talking as if I'm a medical provider and I have all the answers. But what I will say about it is that I think that the bias and the over-reliance of BMI as an indicator of health stops the conversation. I really want people to have the information they need and to understand why. Why is someone's weight or BMI or health or associated factors going to maybe set them up for a negative outcome? I want people to have that conversation instead of just kind of saying, oh, it's just weight and BMI and just lose weight. I think people deserve to understand and know what that's about. So that's why I want people to talk about it.
Totally. And it's interesting, with this question of surgery and being okay for surgery. I know that people like Reagan Chastain have written about how, basically the BMI requirements for surgery are just based on the fact that medical providers and surgeons don't practice on larger bodied folks. They don't get cadavers that are larger body. They don't have equipment to hold, the limbs of people who are larger bodied in surgery. So it's it's really more dangerous, considered more dangerous, quote unquote, for the facility or the surgeon to take on that liability. And it's seen as a higher risk. But in fact, it wouldn't have to be a higher risk if people were trained on how to perform these surgeries, perform, whatever medical intervention is needed on larger bodies. It's just being, learning how to do it.
Yeah, I love that you just named that because yes, I think people don't have training on, and there's this assumption that everyone who's coming in is going to have, this quote unquote normal weight or normal body. And yes, whatever the equipment is that's necessary, well, maybe we need to get different equipment. Maybe we need different training. And, another thing it brings up is, if a surgery were seen as life-saving and medically necessary, then that person would be able to go in and get that surgery. So, I think there's a bias about people think that trans or gender-related surgeries are cosmetic, and they're simply not. They are life-saving. And I don't really know how to reconcile this, because I want answers, I want better answers. But, why is it that it's not safe for someone to go in and get maybe chest reconstructive surgery at a higher BMI, but at that BMI, that person can go in and get bariatric surgery?
Exactly. Or cardiac surgery or anything that's considered necessary.
And if it were seen as medically necessary, but it's not, it's seen as sort of cosmetic or elective surgery.
Like you were saying, it can help reduce suicidality because of gender dysphoria, right? So in that sense, it is incredibly life-saving, life-affirming. Yeah,
reducing gender dysphoria and also helping people to live more safely, in a world that is not safe for people who aren't intelligible in a gender binary, whose bodies and genders just are not, they don't fit. And, we know that there are just astounding rates of violence against trans folks who are not perceived as fitting into, what you should look like for being a man or a woman.
Right. Yeah. So that also is a way to help really save people's lives and affirm people's lives and identities.
Yeah.
And is there any because I'm not super familiar with the trans health world and that's like your specialty. So I'm curious if there's any movement in that world towards classifying these surgeries as, life-saving or sort of putting them on the same level as something like, cardiovascular surgery or whatever versus being elective.
It's not all of trans health. It's not all bad. There are really amazing people doing work who know that these are life-affirming and life-saving procedures and are having these conversations. But I think that the way our medical system or medical industrial complex is set up is like that elective is seen as something that you don't need immediately in this very moment versus something that you need like in this very moment to save your life. I feel like these surgeries aren't taken quite as seriously. I think that there are people who are speaking up a little bit more, but, not a ton of voices. I will say that I'm in a newer sort of stage of my own recovery, like sort of the deep, deep recovery around like orthorexia. And, it's been a really long time since I engaged in some of those more like overt, like eating disorder symptoms. But as I've gotten into more of that subtle, like kind of like, just being healthy, lifestyle change, like, orthorexic, paleo, gluten, whatever, all of that. It's interesting because it's come like right at the same time as me starting to be more vocal. And I think feeling more empowered, like feeling much more empowered to be more vocal about this within trans health. And also starting to come into eating disorder professionals' communities and starting to talk about gender and trans stuff. I don't think I mentioned this earlier, but, I did my dissertation on eating disorders and basically eating disorders NOS and looking at symptoms instead of full syndromes. And I thought I was going to really focus my clinical work in that direction, but I actually got really turned off by the eating disorder professional field. This was, 10, 15 years ago, because I didn't see myself reflected as a person of color, as someone who was, queer, gender nonconforming. I just felt like I didn't honestly feel very safe in those spaces. And more recently, I have this friend and colleague who invited me to speak at this eating disorders conference. Just, I guess it was last month or 2 months ago. And, I feel like I'm starting to re-enter. Your podcast has been really powerful and instrumental for me in starting to hear like all these voices. I think I just kind of was like, this is not a space for me. And then, kind of moving away and focusing more on gender and sexuality and trauma work. And now kind of circling back through trans health to see that there are people who are having these conversations and including about looking at race and inclusion of people of color among, many other categories of identity. So I got to speak at this conference and Gloria Lucas was speaking and sort of opened it up right before me. And she was like so badass. And it like gave me so much permission to be honest about, this is why I haven't actually focused or advertised myself even as someone who does eating disorders work, even though I do. Just really, not wanting to be in like kind of part of what I thought eating disorder professional community looked like. And it may have, but it's shifted. And meeting other trans and genderqueer folks who are also really passionate about this. So, I've been kind of like sort of lurking and following the trans folks fighting eating disorders group and just like watching and being like, this is awesome because it's so intersectional in its approach, this organization. And, it's been on my list to actually reach out and try to like kind of make a connection.
We've tried to get them on the podcast so many times. I'm like, really would love it.
Yeah, so awesome.
I know. I think those intersections are so much more present and talked about. Even like, I think I've been in the field for 5 years or something, and it's become even more spotlighted, I think, recently than it even was when I first started. And I feel like it was very like I was introduced to intersectionality pretty early on in my specialty in this field, but it was still mostly white cisgender women, who were the clinicians who were doing the work. And now it's like we're finally starting to see, I think, more people of color, more trans people, more people of, various different identities kind of coming out and being in the space. And I've gotten more immersed in the health at every size world, which is like a Venn diagram with the eating disorder treatment world, I think. And there's, that small intersection there.
And I really appreciate that, because listening to your I was listening to your podcast and I would hear you say things like, well, people of all genders. And I was like, did she just say that? Because I just assume that, I'm listening to a podcast about eating disorders or food or anything. And of course, it's going to be very binary. Mm-hmm. And so like the more I listened, I was like, what the hell? And so it actually got me thinking more about like, wow, like there is a space for this conversation here. Also really cool.
I'm so glad we're able to have this conversation. I'm so glad you reached out and that really spoke to you, because that's exactly what I want, is for people who are listening to the podcast to feel like they belong, and whatever their issues with food, whatever their gender identity, whatever their any kind of identity, like they're not excluded from this conversation, because we all struggle in our relationship with food in this culture. And like the way that diet culture manifests is so sneaky, and it shows up in different ways in different communities, but like all of it is valid to talk about. And it's not just, I feel like so many, media that are talking about eating disorders and people's relationship with food, and like coaches and, dietitians and therapists who are marketing to help people recover are like writing towards cisgender women. They'll even say like, I help women stop blah, 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 and like, I get it. I get wanting to be, targeting your ideal client, quote unquote, but also like, it's very exclusionary. And I think it does a disservice to people who might be looking at that and thinking, well, I guess I don't deserve help, or I guess I'm not going to be able to find help because that's not me. I'm not a woman, or I'm not, a cisgender woman or whatever.
Right. I mean, it's complicated because I feel like sexism is such a big piece of this. And so I think there's something so empowering about saying like, I help women, who have been targeted to recover. And at the same time, whenever I hear that, I'm like, of course I come from this critical lens around gender. I'm like, well, what's a woman?
Right.
Like, what do you mean women? Which women? And like, and who's included in that or not? Yeah.
Yeah, no, it is this interesting thing, because I mean, feminism, I feel like intersectional feminism has helped me so much in sort of framing all these kinds of discussions, because I came from like a very white feminist background. Like I was a feminist for, a long time in my youth and college. And I learned about feminism from such a white feminist perspective. But then learning about intersectional feminism and learning like, oh yeah, people of all genders are oppressed by patriarchy in this society. And it shows up in different ways. And it shows up a lot in cisgender women. Like cisgender women are one group who is very oppressed under patriarchy, but there's also like all these other groups who are oppressed under patriarchy and white supremacy, and that it's, we can't like speak to one oppression without acknowledging all of the others and bringing them all into the fold.
Yeah, like who doesn't have a seat at the table here?
And even cisgender men who don't conform to like this idea of masculinity, it's like even that needs to be acknowledged too. Right,
absolutely. And I feel like anyone of any identity could be at risk for developing disordered eating, because it's in the air. I mean, like diet culture is everywhere. And that's something I've just like, I see it now in a way that I used to not, like I see it in the way that I used to, even just tell myself like, oh, it's just, this isn't a diet. This is just like a healthy lifestyle change, or, this is about being fit, yeah, that kind of like really insidious kind of thinking that like so many of your guests have talked about, which I feel so grateful for.
I'm so glad. Yeah. How did that sort of manifest for you? How did you first become aware that like that was, orthorexic thinking or diet culture thinking in yourself, and start to recover from that?
Well, honestly, it took like kind of what I characterize as like a major relapse, like into eating disordered behavior. I mean, not, see, this is the thing. I can always rest on this comparison. Well, I'm not as bad as I was when I was in high school, and that I think has really kept me from like looking more deeply at what's really going on. But, something that happened for me a couple years ago is I was going through a lot of medical, like I was dealing and interfacing with the medical system a lot, for health reasons. And, having to go in and see doctors, multiple times a week. And the stress of it. And I think that I fell into like some pretty tight orthorexia. Like it was pretty extreme, and it was kind of in the name of health. Like, oh, well, I need to cut out this, I need to cut out that, and I can't have this. And, some people really do, have like, very valid health reasons for having to adjust the way that they're eating. But for me, I think it was very much about control and feeling really powerless and out of control in a health system and interfacing with these health systems that were also misgendering me. Um, and so, I really kind of swung this other way that I hadn't for a long time. And when I kind of started to come out of that experience of interfacing with these health systems, I just like swung the other way. So it's very classic deprivation, to the other way. And I was like, I want all the things and I want no rules. And, and then, of course, I swung the other way, and I found myself for the first time in just over a decade, many years, actually engaging in a diet, which was sort of framed as like, this is a diet that it's, I was paleo, I was keto, like all these things that are very, also nuanced, because it also helped me to, while I was like kind of embracing being able to eat fat, like, I was also like developing even more fear of like carbohydrates. And I actually learned about you because you went on this podcast that I was listening to that was like, and I don't want to name it. I don't want to, bad mouth anyone, but I really feel like this is a podcast that kind of sort of frames itself as an eating disorders recovery podcast, but I really don't, it's a keto podcast. It's like, this is a way to recover, and this is the non-eating disordered way to be.
Totally.
And I heard you on this podcast, and I was like, whoa, it just resonated so much. And through that, I learned about your podcast. So it's kind of funny that through that, that's how I learned about your podcast.
Oh my God. I'm so happy that happened. I'm so grateful that that's how I came across your radar, because I mean, that's exactly why I go on podcasts like that, even though it's so not my scene. And it's like, I'm like, I don't want to like support this, but also it's like people who are listening to that are vulnerable and like need the message that I'm spreading. And maybe that, maybe it will reach someone in a vulnerable state and they'll be like, okay, wait a minute, let me give this a look,
Yeah. I mean, I could kind of tell. I was like, I could just kind of tell that you were like, full on like, no, this is about intuitive eating and health at every size. And like, these are still rules. And this is still, any rules that we have that are meant to manipulate our body and appearance or lose weight, that's a diet. Yeah, I kind of like fell back into that. And then I like came out of it and was like, whoa. And, I'm really just in this place of practicing intuitive eating, not perfectly, trying to practice, joyful movement, not perfectly. Like the exercise stuff is really the hardest one for me. It's just, like I rely on it so much for many reasons. And I do really, I've had to really pull back. And again, not like as bad as it was before, but, just I've had to really listen to what my body wants and to just be much more gentle and have to kind of make peace with the idea that my body is going to be what it is and it's lovable at any size. And whatever fluctuations I think people are noticing, they're just not, and, I've certainly had partners who most people I'm with, they like really they don't give a shit, like always been the one that has cared and has used it as an excuse for not, being able to receive love or, see myself as lovable. And so, I've done a lot of therapy and a lot of work around this, but yeah, it's that really subtle stuff that I feel really excited about doing this right now, like kind of reaching a different stage in my recovery.
I'm so stoked to hear that. I feel like that's a wonderful place to be. And like the fact that we all live in diet culture, I think it's no wonder. And I had my own sort of long limbo period as well, where I was like recovered enough, quote unquote, and wasn't doing, the really disordered behaviors that I had done in college, but like, or a little bit after college too, but like, it was still dieting and, eating for quote unquote health and, exercising for instrumental purposes and all of this stuff, and like not really in touch with my body. And so it took, quite a while to break all of that down too. But I think it's so easy to stay in that limbo period because that's what our culture tells us is healthy, right? That's what it tells us we're supposed to do.
Totally. And I kind of cringe because, some of the work that I've done with folks who have eating disorders, I've like run support groups and like coping skills groups, and I think about the ways that I was still reinforcing this messaging. I wish I could go back, and like, I think it just really speaks to like how important it is to do our own healing and recovery work before being able to engage in like serving other people who need this. Cause I think, I could only help people to the extent that I had, reached some level of recovery. And, I also want to be a little bit careful about the perfectionism around even the word recovery, because, even I was like, oh, I don't think I should go on the podcast. I'm not fully recovered, and just having to be like, oh, this is an opportunity to just be imperfect and be like, hey, I'm in this process like so many of us are. And, get away from like any kind of shame around still being in it.
Totally.
Yeah.
And it's so valuable. I'm really grateful for you, overcoming that perfectionism and coming on and sharing your story because like,
Scary.
yeah, I know, totally.
I want to be all polished and have all the answers, and I don't think any of us do.
No.
But yeah, I mean, I feel so grateful that I can see just like there are so many layers to this, like this idea of recovery. I mean, something I didn't mention earlier is that I was in a 12-step program for years, so I really have this framework of recovery and also very steeped in diet culture,
Yeah, the abstinence model, right? Like
abstinence model and this idea that like weight loss was a measure of recovery or success, or that, if I know this and know that was recovery. And, as someone who really struggled with restriction, it was actually pretty harmful. And at the same time, I got so much out of some aspects of those programs that helped me to look at, just some of my relationship to food, like all of these things that helped me. It's never just one thing or another. Like there were things that were both helpful and harmful.
I feel like there's nothing in diet culture, or almost nothing in diet culture, that's 100% like perfect, quote unquote. Like living in the society we live in, it's very hard to have any sort of resource that doesn't have a little bit of it still in there. And that's just because people are imperfect. And I mean, I even listened back to, my stuff from a few years ago and I'm like, I would change how I said that. That's still a little bit rooted. It's like we're all evolving. So, but I think, yeah, if you were able to get something from those experiences, but also recognize like, okay, this aspect of it is harming me or this is not serving me, and let it go when you needed to, then that's great.
Yeah. So, and it's, even at this point, trying to like be okay with whatever's happening, like noticing that if I am exercising and I feel really good, I'll find myself being like, I shouldn't feel so good. Like, this is bad, and it's like also just allowing myself to feel whatever I'm feeling and to, just listen. And I mean, I think that's so much of what like so many of your your guests have talked about is just, can we get back to this place of like decolonizing bodies and like just what is true in this moment instead of like the shoulds. So I'm really, really excited about obviously, I want to talk to people about this all the time.
Oh, I love it. I love talking with you, and I love talking with people about this too. Like, just always. It's my favorite thing that I do. And so tell us where people can find you and learn more about your work if they want to, connect with you and work with you and all that good stuff.
Yeah, so my website is sandchang.com. That's SANDCHANG.com. So that's my private practice website, and I do a lot of training. And so, I would say the majority of my work these days is actually more training and education work. I also work for a couple of other organizations. I work for Kaiser, Permanente, and I work for Stanford University at this moment. So my practice is tiny, but I do trainings about gender, and something that I really feel passionate about is bringing gender awareness and trans awareness into the eating disorders recovery field. So yeah, I'm always really excited about people who recognize the need for that kind of training.
I love it. I know we have a lot of providers, and eating disorder specialists listening to the podcast. So I think this will be a great resource for them. So we'll definitely link to your website in the show notes, and, anyone who wants to connect with you can do it that way.
Oh, thank you.
Thank you so much, Sand. It's such a pleasure talking with you. So that's our show. Thanks again so much to Sand Chang for sharing all their wonderful wisdom with us on this episode. And thanks to you for listening, as always. If you're looking for some practical tips to get started on your own anti-diet journey, grab my free audio guide, 7 Simple Strategies for Finding Peace and Freedom with Food. Just go to christyharrison.com/strategies to get it. That's christyharrison.com/strategies. If you've gotten something out of this podcast, please encourage your friends and family to subscribe on Apple Podcasts or iTunes or your favorite podcast platform, which now includes Spotify, which is one of my favorites. Just go to christyharrison.com/subscribe to see all the different platforms available. And don't forget to grab your Self-Care, Not Self-Control t-shirt and mug today, which is at christyharrison.com/swag. That's christyharrison.com/SWAG. To get full show notes from this episode, including all the resources we discussed, plus a full transcript, head over to christyharrison.com/150. That's christyharrison.com/150. And to get the transcript, just scroll down to the bottom of the page and enter your email address where it says Get the Transcript. Food Psych is edited and engineered by Podcast Fast Track. Also, a big thanks to our community manager and content development associate, Ashley Saruya, our administrative assistant, Sarah Thompson, and our transcript assistant, Megan Saichi, for helping me out with all the moving parts that go into producing this show every week. Our album art was photographed by Abby Moore Photography and designed by Meredith Noble, and the music you're hearing behind me now is by a band called AWOL, and the track is called Food, used under the Creative Commons license. Thanks again for listening, and until next time, stay psyched.
Stupid or scared, no work in the kitchen now. Who put you there in that perfect